So the most negative impacts of this BP disaster are on the ecosystem. The sediments in the Gulf, the water column in the Gulf still has crude oil dispersed in it. The organisms, the benthic organisms in the bottom sediment, and all of the aquatic organisms in the water column. And then the marshy areas and wetland areas all along the coast have been severely contaminated with the crude oil and the dispersed crude oil. And for the most part, the marshes could not be cleaned up, so there's huge quantities still there. From a personal perspective, the largest impact is the people who were made very, very sick, were not provided with proper medical care. They've lost their jobs, they've lost their houses, they've lost their vehicles, they've lost their insurance. For the most part, they're just barely hanging on by living with relatives. And they have been excluded from receiving the medical care they so desperately need. So we have taken a segment of the population and made them very sick for the rest of their lives and actually remove them from the productive part of the population. And they are not being acknowledged whatsoever. So the portion of the population that's most impacted by the crude oil and the dispersants are, for one, mostly the fishing community, because they either served as cleanup workers or they were on standby waiting to serve as cleanup workers, but they were in the area. They were there manning their boats, ready to go out and do the response. And then the second portion of that population is the people who actually worked in the industry. A lot of the people that worked on service boats that were out there also being cleanup workers or providing resources, getting people out there, getting the supplies out there, and they were coming in contact with the crude oil and the dispersants. And then the third part is the people who lived in the coastal areas in Louisiana, Mississippi, Alabama, and the panhandle of Florida that were on the beaches or in the marshes and coming in contact with the crude and breathing the aerosol. So those are the three parts of the population that are still very, very sick. One of the issues is that BP was given permission to provide primary health care, pay for primary health care in Louisiana, Mississippi, and Alabama. Now, granted, Louisiana and Mississippi are always at the bottom of the list of primary health care. We desperately need it. But one, we don't need BP paying for it to the exclusion of providing the medical care that the people who were exposed to the BP crude developed. That's where the money should have gone, was to provide them with the medical care they so desperately needed. So the portion of the population that's so ill that it can't continue to work started off with a lot of respiratory problems, a lot of skin rashes, and it developed into things like total loss of memory, not being able to function, and then it went into cardiovascular impacts. And so now it's in all the organs in the body and as cardiovascular and respiratory. And they just are physically unable to get out of bed every morning and do anything that has any sense of normalcy. It's really difficult to see any positive outcomes as a result of the BP disaster. It was so widespread and it was so damaging to the environment and to the humans that inhabit that environment. The working together with all the communities would be a positive aspect, but we could have well done without that if we could have kept the environment as it was and the human population not ill.